Honorable discussants, moderators, and distinguished audience. Today I will talk few minutes on heart failure red flag. So today's lecture is basically development of the awareness, that is the preventive aspect of the heart failure that I will talk on. And among the preventive aspect, when we look into preventive aspect, we should know what is the prevalence or burden of the heart failure in terms of disease burden as well as the burden of the economic part of the heart failure. And I will focus in short about the causes and risk factor of the heart failure. So all of you know the meaning of the red flag. So red flag is in heart failure means little different because this red flag is to develop the awareness. This is designed by the Global Heart Hub, and this is the May month is selected to develop the awareness program on 10th, 17th, 24th, and 31st May. That is the every Friday, leaving this first Friday of the May month. So there, they urges the people to raise the flag on that day to improve the awareness among the people of the nation, every nations or globe, and also to create the awareness among the physicians so that when there is no involvement of the people and physician, there will be ineffective approach to prevent the heart failure. If we look at the burden of the heart failure, that is the patient burden or heart failure disease burden, if we look at the prevalence, it is about 1 to 3% in general population. According to the last consensus in Bangladesh, about 12 crore Bangladeshi people are adult. So considering that 12 to 36 lakh heart failure patients present in Bangladesh, and incidence is 1 to 20 per thousand patients per year. And mortality of the heart failure is also high. And if you look at the cost of the heart failure management per patient per year exceeds 25,000 pounds. So this is the health cost. The health cost of the heart failure is not unique in every part of the globe. That varies. If you look at this graph, the German shows the highest cost of the heart failure management and lowest in the Nigeria. And this is the most important slide of this lecture because this shows what is the reality of the management of the heart failure in the whole globe. There are a lot of evidence for the prevention and control of the heart failure, and there is good evidence by randomized control trial that there is 10% absolute risk reduction in the different trials of heart failure management. But if you look at this evidence goes to the adoption, implementation, reach to the target, and also to the maintenance therapy. And this therapy shows that the systems not prioritized in most of the countries. So there is 50% reduction of this goal in the first step. In second step, the implementation of the heart failure management, the clinicians are not giving the optimum treatment of the heart failure. There is another 50% reduction leading to 2.5%, and ultimately we reach the 1.2%. That is another 50% reduction by patients are not adopting the treatment of the physician. And ultimately, every phase of this management becomes exhausted, and only 0.625%, that is another 50% reduction occurs in the maintenance of the heart failure. So keeping this chart in mind, we have to approach for the prevention of the heart failure. All of we know the age and gender are important risk factor for the heart failure. Heart failure is more prevalent after 65 years of age, and it is more common among the female by the USA data. And every 10 years increase of the age, there is doubling of the heart failure in prevalence in adult male, and it is triple. It becomes triple in the adult female. So if we look at the gender variation, the female patients with the heart failure are relatively older, having higher BMI, higher ejection fraction, greater prevalence of the hypertension, diabetes, and kidney dysfunction. This is the chart in female gender shows that after 40 to 50 years, the heart failure incidence rises. And this rising is greater in heart failure with preserved ejection fraction than this is the stages of the heart failure showing the prevention of the heart failure, that is the primary as well as the secondary prevention. These are the age distribution of the heart failure patient. I am not going in detail. I can show you the distribution of the patient in our study and in the global perspective. In our population, the heart failure with reduced ejection fraction, hypertension prevalence is relatively low, that is very high in USA. And our population, ejection fraction low in coronary artery disease compared to other part of the globe. And these are the probable causes that leads to the heart failure development. Coronary artery disease, though very common in male individual, but if you look at the heart failure with reduced ejection fraction, 63% women are with heart failure with reduced ejection fraction. Diabetes is one of the important parameters, not only by atherosclerosis. It is producing heart failure in 20% of the people by diabetes, by its independent effect, that is by the development of the hypertrophy, insulin resistance, and lipotoxicity leads to heart failure with preserved ejection fraction. But oxidative stress, fibrosis, and autoimmunity that is produced by the diabetes leads to heart failure with reduced ejection fraction. And diabetes itself can cause the diabetic heart failure. Hypertension also, all of you know, I am not going in detail. Statin therapy has got good preventive role in the development of the heart failure. So smoking also plays role, but obesity is one of the important part in the development of the heart failure, especially in the female. So truly, prevention of the heart failure in the stage of A is the most important part to prevent the development of the heart failure and reduce the disease burden as well as the patient burden of the patient. What is that? Have I got 48 minutes, seconds more? So in that time, I could discuss about only the obesity. Obesity is one of the important factors that is more important among the female because obesity is associated with the increased risk of developing heart failure with preserved ejection fraction, and that is increases proportionately with the increasing BMI. And pathophysiologic mechanism that includes the systemic inflammation, insulin resistance, coronary microvascular dysfunction, myocardial remodeling, and fibrosis that occur associated with obesity that leads to heart failure. Thank you very much. Thank you.
Thank you, sir, for your nice presentation.